Have you ever felt that frustrating sensation when your nose is blocked, making it hard to breathe freely? For individuals with cystic fibrosis, maintaining clear airways is a daily priority, and that includes an often overlooked area, the nose. Incorporating nasal care into your daily cystic fibrosis routine is crucial for managing symptoms and preventing complications. It involves consistent cleaning and medication delivery to help keep your nasal passages clear and healthy. This proactive approach supports your overall respiratory well-being. The reason nasal care is so important for cystic fibrosis is directly related to the condition itself. Cystic fibrosis causes the body to produce thick, sticky mucus, and this affects more than just the lungs. It also impacts the sinuses, which are the air-filled cavities around your nose. When this thick mucus builds up in the sinuses, it can lead to blockages, inflammation, and chronic infections. These infections can then make it harder to breathe and may even affect your lung health. Proper nasal care, such as saline rinses and prescribed medications, helps to thin this mucus, reduce inflammation, and deliver treatment directly to the affected areas, helping prevent infections from taking hold. So how can you practically integrate this into your daily routine? A key step is regular daily saline lavages or rinses. You can use a neti pot or a squeeze bottle for this. Always use sterile water, which means water that has been boiled and then cooled or distilled water. Lean over a sink, tilt your head slightly, and gently irrigate one nostril, allowing the water to flow through your nasal passages and drain out the other nostril or your mouth. Then repeat the process for the other nostril. This simple action effectively washes away thick mucus, allergens, and any environmental irritants that might be trapped in your nasal passages. Beyond saline rinses, many individuals with cystic fibrosis are prescribed nasal steroid sprays or other medicated rinses by their care team. These medications are specifically designed to reduce inflammation in the nasal passages. It is generally most effective to administer these prescribed treatments after you have completed your saline rinse, as the cleaner nasal passages will allow for better absorption of the medication. Always follow your doctor's specific instructions for any prescribed nasal medications. Remember, consistency is absolutely key for these routines to be effective. Make it a habit, perhaps doing it at the same time as another daily treatment, to ensure you stick with it. Also, always clean your neti pot or squeeze bottle thoroughly after each use to prevent bacterial growth. It is helpful to remember that the upper airway, meaning your nose and sinuses, and the lower airway, your lungs, are often considered a connected system. This means that problems in your nasal passages and sinuses can indeed impact your lung health. Consistent and effective nasal care, therefore, not only helps reduce the frequency of sinus infections, but also contributes to lessening the overall burden on your lung function. It is a vital part of comprehensive cystic fibrosis management. By consistently performing nasal rinses and using any prescribed medications, you are actively working to keep your nasal passages clear and healthy. This simple, consistent habit not only brings relief from congestion and discomfort but also forms a vital part of your overall cystic fibrosis management. Ultimately, it contributes significantly to better respiratory health and an improved quality of life, allowing you to breathe a little easier every day.